Good afternoon. Welcome to day 273 at the EMA office, where I'm joined with Chairman Mark Kern and Sam Bierman from the Health Department. And Sam, we have a little bit better numbers today.
We do. Our numbers are better than yesterday, and we are hoping that they continue this way. So as of today, 177,484 St. Clair County residents have been tested, which is an increase of 2,136 from yesterday. We have 17,589 positive test results, which is an increase of 241 positives from yesterday. And that does include both males and females from under the age of 1 up to their 90s. Today, our daily county positivity rate is 11.3%. We are at 159,895 negative test results. Unfortunately, we are announcing 3 additional deaths today, which does bring our total for St. Clair County to 286. We had a female in her 80s, a male in his 80s, and a female in her 90s, all with unknown health conditions. And as always, our sympathies go out to their families. For those who have completed the IDPH required 10-day isolation period, we are at 14,921. For state totals, 11,586,296 have been tested, with 832,951 positive test results, which is an increase of 9,420 from yesterday. And for deaths, the state is reporting 14,050, which is an increase of 190 from yesterday. For our hospitalization rates in St. Clair County, currently we have 94 patients that are admitted due to COVID-related reasons, and 6 of them are on ventilators. Regionally, we have 216 patients that are admitted due to COVID-related reasons, and 19 of them are on ventilators. For our congregate living facilities that are currently or previously been in outbreak status, these are cumulative numbers, and we will only announce any facilities that have had changes. Caseyville Nursing and Rehab has 151 cases and 8 deaths, and that is an increase of 1 death for that facility. Freeburg Care Center has 17 cases and no deaths. That is an increase of 1 case for that facility. New Athens Home for the Aged has 81 cases and 10 deaths. That is an increase of 1 case for that facility. And Willow Creek in Belleville has 3 cases and no deaths, and that is an increase of 1 case for that facility. We do still have some testing available this week, Sunday, December 13th, at New Life Church in O'Fallon, and that will be from 8 a.m. to 4 p.m. And if you need more details on that, it is located on both the EMA Facebook page as well as the Health Department Facebook page. And before I turn it over to Chairman Kern, I did want to show a graphic of at St. Clair Mall. Right now, it is set up with 4 lanes, all for testing of COVID-19, but eventually some of those lanes will transition over to being able to give vaccine. And so you can see that they have 2 drive-up tents. There's 4 lanes total. And as we said, it's testing right now, but we'll transition into vaccine once we get that. And we are hoping that that will be arriving for our hospitals sometime next week. So exciting week.
And that's testing there 7 days a week.
Correct, 7 days a week from 8 a.m. to 4 p.m. Yes.
So there's a lot going on. So people really have a reason to be optimistic, I
Yes.
think, and
Yes.
this is so hard because people have fatigue. They're just, some people are just wanting to throw caution to the wind, but hold on a little longer. The vaccine will be coming out next week, and they're going to roll it out for. It's not going to be for general population for
Correct.
a couple months,
Correct.
but it's on the way.
It
So,
is. And
hang on.
we have high hopes that both brands right now, Pfizer and Moderna, Pfizer is what we are going to be receiving in our first shipment. We hope that Moderna is not long to follow, and that hopefully both of those companies can produce that vaccine, a quality vaccine at a quick enough rate that it will help us work through our tiers quickly enough to get those general population vaccination clinics up and running as soon as possible.
And since everyone requires 2
Yes.
2 doses, it takes a little longer than
It does.
Given what
Just a single dose.
what we're allotted. So.
Yes. So, but keep the faith. We are certainly moving in the right direction, and we are seeing the light at the end of the tunnel. It's very little right now, but it is there. So.
And St. Clair County has a plan. and
Yes, we do.
We're gonna make things work.
Yes, and we're in daily conversations with IDPH and other counties to make sure that our plans are as solid as they can be.
Thank you, Sam.
Absolutely.
Chairman, one of our followers from Team St. Clair said she had got tested at the mall today and it was real smooth. So that's what we like to hear.
We've even heard, and I don't have any hard evidence of it, but someone that they know got a test result back within 24 hours from the
Yes.
mall. So hopefully these testing times and the time to get the results are also shortening, which makes it so much more meaningful when you get that test back right away.
Exactly.
You know to quarantine. You know that you're infectious.
Yes, sir.
Okay, well, speaking of infectious, let's look at the new COVID positives in these St. Clair County zip codes. 62201, today we're up 2 to 428. 62203, we're up 13 to 446. 62204, we're up 4 to 288. 62205, up 6 to 436. 62206, up 11 to 859. 62207, up 2 to 414. 62208, up 20 to 998. 62220, up 14 to 1,191. 62221, up 14 to 1,639. 62223, up 16 to 1,065. 62225, up 1 to 89. 62226, up 26 to 1,890. 62232, up 7 to 577. 62239, up 5 to 261. 62240, up 3 to 90. 62243, up 7 to 390. 62254, up 6 to 546. 62257, up 5 to 184. 62258, up 8 to 655. 62260, up 6 to 426. 62264, up 2 to 2007. 62269, up 36 today to 1,845. And 62285, up 1 to 338. 241 new positives in our county, 2,136 tested, brings our daily county positivity to 11.3%. We put that in the calculator and we come up with a 7-day rolling average today of 13%. And that's the lowest rolling average that we've had the entire month of December. So we hope that that continues to move in that direction. The state pegs us today at 14.5% regional positivity. Bond County comes in at 8.5%. Clinton County at 11.5%. Madison County at 12.6%. Monroe County at 14.4%. Randolph's the lowest today at 7%. St. Clair County, 11.5%, and Washington County tops us out at 26.1%. Herb, when I look at these numbers, I think the age ranges today really are something to point out. 106, so out of the 241 people that came up positive, 164 of those are below 50 years of age. So, at the beginning, the 70s, 80s, 90s made up most. Now that's 77 of the 241 are in their 50s, 60s, 70s, 80s, and 90s, but 164 below 50, and 46 are teenagers or younger.
Or younger. Yeah, it just shows that the demographics there's no boundaries that this virus isn't attacking the same way like with the zip codes, and we talk about that. It's everywhere, and that's what we really had to try to stress for 273 days. And those numbers are, hot off the press. We get them daily, and I think that's something that Team St. Clair needs to be aware of when they're out sharing this. It's in the younger population, and we've got to slow it down. I mean, we get a little excited today when Sam calls over with these numbers and they're going down. And I mean, and of course, the one I always watch is that regional positivity. It went down to 14.5 from 15.1. So anytime that we can show a decrease, we want to get excited about that.
And there's a reason for going down. It's because of the mitigations.
Mitigations.
And the mitigations are hard, and we don't like them. But we know that if we're going to get these numbers down, the way you do it, you wash your hands, you watch your social distance, and you wear your mask, and you kind of make sure that you only go out when you have to, and you make sure that the environments that people are not ones that are conducive to the spread of this virus.
Well, and I think if people would take this into perspective, we've been worried about the Thanksgiving, and that, we're coming out of that, which I think is a lot better than what anybody anticipated. Getting ready to go into Christmas, we got to knock on wood. But if we're able to get these numbers going down like we are a little bit at a time, if more people would take that initiative, we could really decrease those numbers and get down to where we have to be, and then these mitigations will fall by the wayside. But we need everybody, need that team St. Clair working. You mentioned yesterday a little bit about the new facility on Main Street. We got a picture we want to show up here today. You can see it there on the screen.
So a lot of people will remember this as it was the Boatman's Bank of America drive-through facility. Always was a great access, a great way to do banking. We hope it's going to be an even better way to do testing and vaccination. So a lot of improvements going on with the facility, but it's going to be ready very soon. I know Barb Holt from the Health Department, she's been working in concert with the construction folks, making sure that everything's ready when we open this thing up, and that should be in the not too distant future. It'll be equipped with the necessary equipment to handle the vaccine, and we hope that it's going to become a very successful part of our fight to end COVID-19.
Well, and like we said yesterday, everybody needs to do their own research on this vaccine, and I'm sure a lot of you as Team St. Clair members are doing that. I saw a lot of comments last night about, hey, I'm ready, I want to get it, and we'll be keeping you up to date when that information is available. This, our good friend Sam will keep the phones ringing over here letting us know, because she's kind of the vaccine guru right now, and we rely on her for all that information. But we're going to get through this, day 273. Yes, we have more days ahead of us. The light is getting brighter, but we've got to have your help. We've got to continue to get these numbers going down, and together we can do it. As the chairman said, we know it's tough. We know everybody's full of fatigue. We get those calls. We get those messages. The businesses, please try to support your businesses. Carryouts, curbside service. I know a lot of people have been trying to support them that they can.
And tip a little better if you can.
Yeah.
The servers, they don't have near the amount of business that they had, so they suffer too. So if you can add a few bucks onto the tip or more, a lot of people are deciding to double the normal, the normal tip they leave, or tip the same amount as the bill. It helps if you have the ability to do that. Now's the time to really kick in and help out our local businesses, because we want them to be there when we get out of this summer. We're all going to be back in our favorite restaurants, our favorite bars, and we want them to still be around and be healthy enough that they're there for us.
And I like the idea that you talked about yesterday, or after all this is over and everybody's sitting around talking about it, and we're giving thought to all those who gave their life for it. I like the idea of maybe some type of holiday, that people can say, hey, because this is going to be one for the book, I can tell you. And I referred a couple of business owners today to Rick Stubblefield, the grants department, on some of the grants possibility there. So take advantage of that. Call over to the Intergovernmental Grants Department if you're a business and you need some assistance, and Mr. Stubblefield's staff will talk with you and see what help can give there. And you have to ask. They're not mind readers. So we'll be back in just a few moments with Daisy to translate this into our Spanish communities, and then we'll be back tomorrow, hopefully with more numbers going down for day 274. Have a good evening.
I have battled this virus both professionally and personally. Professionally, I can tell you firsthand that it's greatly impacted our community, caused the loss of many lives, and continues to spread today. Personally, I can tell you that I contracted COVID-19, and it definitely is not the flu. This virus affects everyone differently, however, many have severe consequences. Please take this time to help your friends, your family, your neighbors, and the entire region by wearing a mask, washing your hands, and watching your distance. Together, we will overcome this invisible enemy.